So my wife Ragini, so she suffered from cancer. She was a young girl, 32, 33 when it first got diagnosed to be a melanoma. एक रेयर वेरिएंट था मेलानोमा का जिसको डायग्नोज किया अभी सब जगह सेंटर्स में ओपिनियंस के लिए भेजा भी गया. इट वाज रेयरेस्ट ऑफ द रेयरेस्ट, only 14 cases reported in the world.
Apart from your wife, the other family members, your daughters, उन सब का mental state कैसा था over a period of 5 years? How do you help others who are going through a similar journey?
6 months, 1 year before she passed away, दिमाग में उसके चालू था कि we should start helping in whatever small way इन कैंसर पीड़ित पेशेंट को. तो लास्ट 6 दिन में जब हम उसे घर लेके गए, जब सबको पता था कि अभी बस टाइम आ गया है, तो उस टाइम पे हमने हमारा फाउंडेशन लॉन्च किया, स्प्रिंकल्स कैंसर केयर फाउंडेशन. द पर्पस ऑफ दिस फाउंडेशन वाज टू हेल्प एवरी पेशेंट ऑफ कैंसर.
ऐसा माना जाता था that a cancer was a disease of the old and the elite because you would be probably a smoker of a certain type of cigar and you've lived your life and you're in your 70s and you will be diagnosed with lung cancer. So cancer is a great leveler and yes, we do see a great transition in people being diagnosed early. तो जो ईश्वर ने बनाया है, अगर वो जब बनाया है तभी आप वो इस्तेमाल करते हो, it is not carcinogenic. अगर जो ईश्वर ने आज बनाया है वो आप 1 साल के बाद खाना चाहते हो, उसको प्रोसेस करके उसमें एक्स्ट्रा सॉल्ट डाल के यू आर ट्राइंग टू मेक दैट प्लांट लिव अननेचुरली फॉर अ वेरी लॉन्ग पीरियड ऑफ टाइम, इट्स व्हेन यू आर पोटेंशियली एक्सपोजिंग योरसेल्फ टू अ रिस्क. यू आर ईटिंग व्हाट यू शुड नॉट ईट. व्हाइल वी वांट थिंग्स क्विकर, यू आर आल्सो गेटिंग कैंसर क्विकर एज अ गिफ्ट.
What are the first few signs that a person undergoes that should be a very high suspicion for cancer? Hello everyone, welcome to DTalks with Dr Kapil. Friends, you would have noticed one thing, आजकल बहुत सारे hospitals, and I'm talking about big chains, are coming up with the development of a complete new building. और आप अगर फाइन प्रिंट अगर पढ़ोगे तो आपको ये समझेगा कि पूरा बिल्डिंग is dedicated only to one disease, and that disease is cancer, the big C. और ये क्यों हो रहा है? इतने सारे लोग इतना पैसा इन्वेस्ट करके बिल्डिंग जो बांध रहे हैं एक ही बीमारी के लिए, इज इट जस्टिफाइड? इज इट अ हाइप? इज इट मार्केटिंग? व्हाट एग्जैक्टली इज दिस? ये सब हम जानेंगे आज के ये पॉडकास्ट में. दिस पॉडकास्ट इज डेडिकेटेड स्पेशली एंड स्पेसिफिकली फॉर कैंसर. और आज कैंसर के बारे में डिस्कस करने के लिए हमारे स्टूडियो में 2 डॉक्टर्स हैं. द फर्स्ट इज डॉक्टर वशिष्ठ मनियार, हु इज वन ऑफ द लीडिंग वॉइसेस बिहाइंड MOC. क्या है MOC? ऑब्वियसली हम ये पॉडकास्ट में जानेंगे. और दूसरा है डॉक्टर कपिल सालगिया, हु इज अ लविंग, हु इज एन एनर्जेटिक, हु इज माय सीनियर in pulmonology from Bombay Hospital. Remember, Dr. Kapil sir wants to narrate a very special story for all of us. So believe me guys, watch this podcast to answer all your queries about cancer. Hello and welcome both of you to DTalks with Dr. Kapil. वशिष्ठ भाई, आप तो बहुत बड़े ऑन्कोलॉजिस्ट है, तो आपके लिए तो बहुत सारे कैंसर रिलेटेड सवाल तो हम पूछने वाले. कपिल सालगिया सर, आप वन ऑफ द टॉप लीडिंग पल्मोलॉजिस्ट नॉट ओनली ऑफ मुंबई बट पूरे इंडिया की है. बट सबसे पहली बात, मेरा जो फोकस है आज का जो पॉडकास्ट है ये कैंसर के ऊपर है. मैं शुरुआत करूँगा सर आपके साथ. I believe you have a story to share with all of us. If you could please go ahead.
Thank you, Kapil. So my wife Ragini, so she suffered from cancer. So she was a young girl, 32, 33 when it first got diagnosed.
My God.
It was a very coincidental thing. She was having a headache. We went for an MRI and we just said, let's do an MRI of the spine since she's in the machine intermittently just to screen. And we picked up a lesion. वेरी क्लासिकल. उसको निकला शॉनोमा है, बिनाइन, नथिंग टू बी डन. कुछ महीनों में दर्द बढ़ता गया तो अभी हमने निकाल भी दिया सर्जरी करके, जस्ट बिकॉज थोड़ा सिम्टम्स आ रहे थे. एंड इट गॉट डायग्नोस्ड टू बी अ बिनाइन लीजन.
ओके.
बॉम्बे में 2-3 सेंटर में दिखाया बिनाइन लीजन, बट थोड़ा सा कालापन था, मेलानोसाइटिक. सब अच्छा चल रहा था, वी आर ऑल ओके, मूविंग अवर विथ लाइफ. 6 महीने बाद एक रिपीट स्कैन किया तो उसके अंदर बीमारी वहाँ भी बढ़ गई थी और 6-7 मेटास्टेटिक लीजन्स भी आ गए थे.
ओके.
तो जून 2019 में शी अंडरवेंट अ वेरी मेजर सर्जरी, जिधर L3 L4 जो पूरा ब्लॉक था वो निकाला गया, नर्व्स निकाली गई, जिधर जिधर कैंसर दिखा सब निकाला गया विद अ टीम ऑफ 3-4 सर्जन्स एट बॉम्बे हॉस्पिटल. एंड इट गॉट डायग्नोज्ड टू बी अ मेलानोमा. एक रेयर वेरिएंट था मेलानोमा का,
ओके.
जिसको डायग्नोज किया भी सब जगह सेंटर्स में ओपिनियंस के लिए भेजा भी गया. इट वॉज रेयरेस्ट ऑफ द रेयरेस्ट, ओनली 14 केसेस रिपोर्टेड इन द वर्ल्ड.
माय गॉड.
फिर थेरेपी शुरू की गई उसकी. तो डिसाइड किया रेडिएशन थेरेपी लेना है, इम्यूनोथेरेपी लेना है, एंड दैट स्टार्टेड द साइकिल.
ओके सर, कुछ सवाल मैं यहाँ
जी.
पे पूछूं. आपने बोला था कि आपकी वाइफ का उम्र था 32 रफली व्हेन शी
जी,
गॉट डायग्नोज्ड. सो
जी.
दैट्स ऑब्वियसली अ वेरी यंग
जी.
एज, यू नो, अनफॉर्चुनेट टू गेट डायग्नोज्ड. सेकेंड चीज आपने जो बोला कि ये बहुत ही रेयर कैंसर है, मतलब पूरी दुनिया में सिर्फ 14 केसेस
14 to 15 रिपोर्टेड केसेस थे.
So would you retrospectively say that in a way, I'm not saying completely, but in a way, you are lucky that at least वो diagnose हो पाया in the time कि आप कुछ तो therapy आप दे पाए?
Definitely. So I would say कि because we did a test and we followed it up, we were able to pick it up.
Okay.
And I guess कि जो भी treatment मिला, at least you were able to give her 5 years.
Okay. सर कभी कभी ना एक चीज़ होता है जो हम लोग हमारी ज़िंदगी में भी टेक इट फॉर ग्रांटेड. आई बिलीव दैट द नंबर ऑफ ईयर्स इज समथिंग जो हम ग्रांटेड ले लेते. अब आपने एक स्टेटमेंट बोला, मुझे बहुत अच्छा लगा कि वी वर एबल टू गिव हर 5 ईयर्स. ये जो 5 ईयर्स का जो पीरियड था, इसमें आपका एंड अपार्ट फ्रॉम योर वाइफ द अदर फैमिली मेम्बर्स, योर डॉटर्स, उन सब का मेंटल स्टेट कैसा था ओवर अ पीरियड ऑफ 5 ईयर्स?
So you know when you get married, बच्चे होते, so you always feel, and अपना busy working style as a doctor, फिर कर लेंगे, जब टाइम आएगा तब कर लेंगे. And that is the time when it struck कि टाइम ही नहीं है. And sometimes you, in retrospect, I feel कि जब लाइफ में कोई अपॉर्चुनिटी होता है, you have to spend time with your family and everything. It should be done at the right time. You cannot be keeping everything for back end. So definitely it was tough. My daughters were very young, so they are 16 now. So one was 11, one was 6, 7 when it all got diagnosed. But I guess my wife was mentally very strong. And throughout the entire course of disease, she always kept her faith. She was always mentally very strong with a strong willpower. Always very jovial with all the oncologists, surgeons, went through surgeries like a breeze, rehabilitation. So I guess that was a very strong motivation factor for all of us.
Okay.
There was never Rona Dhona in the house. It was always positive. She always wanted to do new things in spite of getting debilitated.
यहाँ पे ना दोस्तों मैं आप लोग को एक चीज़ बोलना चाहता हूँ कि हम अक्सर ये देखते हैं, यू नो, men traditionally think of themselves as much stronger, you know, bigger, stronger, एक वैसे रहते, but in these times emotional strength जो फीमेल्स में रहता है, आई डोंट थिंक सो मैन तो कहाँ पे भी कंपेयर कर पाते. मतलब जो इमोशनल स्ट्रेंथ जो एक औरत दिखाती है, आई डोंट थिंक सो मैन कंपेयर एनीवेयर, एंड दैट इज व्हाट आई थिंक यू हैव शोन इन योर एंटायर स्टोरी विथ रिगार्ड्स टू योर वाइफ.
Yeah, so she was an acclaimed dancer and she was running her own academy for dance.
Okay.
When this struck and when the surgeries happened, they were not expecting her to move her left leg. So she went through intense rehabilitation to stand back on the legs, to start walking again. So everything I realize now, you know, she would call me up and say, Kapil, I walked 5 steps today. For her, those 5 steps were like 500 steps. And for us, it was nothing. And for a person who was a dancer, she had to give up dancing. So then she took up to singing. She performed on stage as a singer. Then she did for even a lot of programs she did for singing. Gradually, the disease progressed. Pleural effusions happened. She was unable to sing. That's the time she became a critic. She became a critic analyst for a lot of books, including famous authors. So I guess she never lost hope with life. She always thought that she will be on. And whatever the life is throwing at her, she has to take it and then move ahead and do something to optimize her utility. So that was there till the end. And that was the inspiration to everyone around us in the family. Like everyone right from my friends to my doctor colleagues to her treating doctors to the entire people whom we knew. So she was always an inspiration.
सर आई थिंक इंस्पिरेशन तो एक करेक्ट ही शब्द है, नॉट ओनली टू यू, लेकिन मैं बोलूँगा कि आपकी वाइफ का स्टोरी सुन के इट्स एन इंस्पिरेशन टू ऑल ऑफ अस, इंस्पिरेशन टू सो मेनी पीपल हु आर वाचिंग दिस पॉडकास्ट, दैट नो मैटर व्हाट कार्ड्स यू आर डेल्ट विथ, लेकिन देखिए आपको आपका जो टाइम जितना भी है यू हैव टू मैक्सिमाइज इट, यू हैव टू यूटिलाइज इट टू द बेस्ट ऑफ योर पोटेंशियल. सर कुछ और सवाल मुझे पूछना है कि देखिए आप एक एस पल्मोलॉजिस्ट हो, आपके करियर में हो सकता है कि आपने थाउजेंड्स ऑफ पेशेंट्स को आपने डायग्नोस किया होगा विथ लंग कैंसर, लेकिन जब आपको और आपका फैमिली को जब फर्स्ट टाइम व्हेन यू हर्ड दैट योर वाइफ हैज बीन डायग्नोस्ड विथ कैंसर, टॉक मी थ्रू व्हाट वाज गोइंग ऑन इन योर माइंड.
So as a doctor, when you hear such things, आप पूरे टूट जाते हैं. क्योंकि एज ए डॉक्टर हम हमेशा सबसे नेगेटिव इम्पैक्ट क्या हो सकता है उसके बारे में सोचते हैं, एंड हमने कभी कैंसर के बारे में सोचा नहीं था. कैंसर, फिर इस प्रकार का कैंसर जिसका ट्रीटमेंट लिमिटेड है और इतना रेयर ट्यूमर इंडिया में, सो इट वाज वेरी हार्ट ब्रेकिंग, छोटे बच्चे वगैरह. सो टाइम लगा, एक्सेप्ट करने को टाइम लगा, बट रियलाइज़ किया कि रोने धोने से तो कुछ होना नहीं है, ट्रीट तो करना है. सो रादर अग्रेसिवली ट्रीट करें. जिनकी ओपिनियन ले सकते थे ओपिनियन लिया. एज ए डॉक्टर एक्सेस था वर्ल्ड में सब डॉक्टर्स की ओपिनियन लेने का, जिन का सहारा था सबसे ओपिनियन लिया एंड देन डिसाइड किया और ट्रीट किया.
आई थिंक एक्सेप्टेंस शब्द जो है,
एक्सेप्टेंस इज द थिंग. एंड एक इम्पॉर्टेंट चीज़ जो मैंने सीखा है कि अपन कितनी बार, अभी वशिष्ठ भाई विल ऑल्सो अग्री विथ मी, कि लोगों को कैंसर होता है और फैमिली बोलती है पेशेंट को मत बताओ, पेशेंट को मत बताओ. बट लोग ये नहीं समझते हैं कि सब झेलना तो पेशेंट को ही है.
करेक्ट.
कभी ना कभी तो पता है, पेशेंट को भी तो पता है कि रोज मैं जा रहा हूँ, दवाइयाँ ले रहा हूँ, मेरी पेट स्कैन हो रही, मेरी बायोप्सी हो रही, तो कुछ तो रॉन्ग है.
करेक्ट.
लोग अगर पेशेंट को एक बार बताए, बराबर से न्यूज़ ब्रेकिंग हो, तो कम से कम पेशेंट को अपनी लाइफ का पर्सपेक्टिव तो आ जाता है कि अगर उसे पता चले कि मेरे पास टाइम लिमिटेड है तो उसको जीवन में क्या करना है. दैट बिकम्स वेरी इंपॉर्टेंट एंड पीपल डोंट रियलाइज कि पेशेंट के पास जो स्ट्रेंथ है, गेम मेंटली है. अगर मेंटली एक्सेप्ट हो गया तो बाकी जो भी डिजीज रिलेटेड या तो दवाई रिलेटेड कॉम्प्लिकेशंस भी हो, आदमी हंसी खसी एक्सेप्ट और टॉलरेट कर लेता है.
ट्रू. आई थिंक ये बहुत गोल्डन वर्ड्स एक्चुअली जो आपके मन से आ रहे हैं. दिस इज अ वेरी इंडिया स्पेसिफिक प्रॉब्लम. बहुत सारे हमारे क्लिनिक में हम ऐसा देखते हैं ना कि प्लीज आप पेशेंट को मत बताइए, आप हमें बताइए, आप पेशेंट को मत बताइए. ये बहुत कॉमन सिनेरियो है. समवेयर दिस इज चेंजिंग एंड दिस हैज टू चेंज बिकॉज मेंटल स्ट्रेंथ एक पेशेंट का इज नॉट समथिंग जो हम अंदाजा लगा सकते. So, we have to obviously go ahead and we have to give the maximum utilization and potential that a person has. मुझे बस आपको पूछना है कि शायद से ये इंसिडेंट्स होने से पहले आप एक कैंसर का पेशेंट को जो देखते थे और आज जब आप एक देखते हो तो आपका पर्सनली क्या डिफरेंस है?
सो डेफिनेटली पहले काफ़ी बार एक टेक्निकलिटी हो जाती थी, मैकेनिकल हो जाता था, देखा, उनको बताया, ट्रीट किया. बट जब खुद उससे सफ़र करते हैं तो बाकी के जो इमोशनल एस्पेक्ट्स है ऑफ कैंसर वो ध्यान में आने लगते हैं. क्योंकि खाली पेशेंट नहीं, पेशेंट की यातना, पेशेंट का पेन, पेशेंट का सफरिंग तो एक है, जो पेशेंट से एक एम्पैथी थोड़ी ज़्यादा बढ़ जाती है. दूसरा इम्पॉर्टेंट है, ये पूरे फेज़ में पेशेंट का तो सब सोचते हैं पर पेशेंट के केयर गिवर के बारे में कोई नहीं सोचता. कि पेशेंट का जो केयर गिवर है उस पर क्या मेंटल स्ट्रेस, इमोशनल स्ट्रेस, हर एक प्रोसीजर करना, प्रोसीजर के रिजल्ट के लिए वेट करना, उसके आगे क्या होगा, फाइनेंसेस अरेंज करना, काम पे नहीं जाना, बाकी की पूरी लाइफ को विथहोल्ड कर देना. पेशेंट तो नहीं जा रहा है बाहर, उसके साथ फैमिली भी काफ़ी जाती. तो आई गेस एक हॉलिस्टिक अप्रोच पेशेंट के लिए होना बहुत ज़रूरी है, जिधर पेशेंट के साथ उसकी जो फैमिली, इमीडिएट फैमिली मेम्बर्स है, what they should expect, how they can deal with. So that supportive care is also very important. So जैसे वशिष्ठ भाई will also agree with me, as a cancer doctor, it is not just about कि कैंसर बता दिया और दवाई लिख दी. उनका काउंसलिंग करना, उनके साथ बैठना, टाइम स्पेंड करना एंड बी अवेलेबल टू देम. बिकॉज हमारे लिए तो उनका हल्की सी खांसी, उल्टी इज जस्ट अ सिम्टम, पर उनके लिए तो बहुत बड़ी चीज़ है. तो हर एक स्टेप के ऊपर उनको सपोर्ट होना, either with the doctor or your doctor's team, someone who is available to them, फॉर इमोशनल काउंसलिंग, एज बीमारी बढ़ती है पैलिएटिव केयर, तो काफ़ी चीज़ें आती है. बिकॉज द लास्ट 2-3 months फॉर कैंसर, when they go into stage 4 disease, nothing can be done for them, is extremely painful. And वो जो दवाई और जो यातना है उस टाइम के अंदर आई गेस पेशेंट को और पेशेंट के रिलेटिव्स को दोनों को बहुत ज़्यादा सफरिंग होती है मेंटल.
आई कंप्लीटली अग्री विथ यू सर कि आप जो बोल रहे हो कि कभी कभी जो केयर गिवर है उसके ऊपर बहुत ज़्यादा अटेंशन पे नहीं करते बिकॉज मेंटली, साइकोलॉजिकली, इमोशनली, फाइनेंशियली a lot also goes through on the caregiver. Completely agree. Sir, because you yourself have gone through this entire journey, and how do you help others who are going through a similar journey?
So जब ये हमारा ट्रीटमेंट शुरू हुआ, आई गेस मेजॉरिटी ऑफ आर ट्रीटमेंट अपार्ट फ्रॉम गोइंग अब्रॉड टेकिंग ओपिनियंस हमारा टाटा में हुआ. तो एवरी टाइम दैट वी वेंट टू टाटा जाते थे, वहाँ इतने बच्चे दिखते थे. अमित, आई वुड से कि वी वर लकी. हमारे को बीमारी हुई बट भगवान ने फाइनेंशियली भी हमको ब्लेस किया हुआ था कि हम लोग हर वो स्टेज पे पहुँच सके, बायोप्सी ट्रीटमेंट इतने टाइम तक पहुँच सके जिधर 5 साल हम लोग ने ट्रीटमेंट लिया. पर काफ़ी लोग हैं इस देश के अंदर जिनको बेसिक ट्रीटमेंट, खाने पीने का भी तकलीफ रहता है. आप टाटा अस्पताल में जाए, किधर कैंसर का ट्रीटमेंट लेने के लिए लाइन लगानी, किधर रहेंगे, किधर खाएंगे. हम लोग अपने घरों में अपन इतना ज़्यादा वो करते हैं. तो ये सब देखते हुए रागिनी की डिज़ायर थी कि वी शुड बी एबल टू डू समथिंग फॉर देम.
ओके.
एंड 6 months, 1 year बिफोर शी पास्ड अवे, दिमाग में उसके चालू था कि वी शुड स्टार्ट हेल्पिंग इन वॉट एवर स्मॉल वे इन कैंसर पीड़ित पेशेंट को. और नाम भी उसने सोच के रखा था. और जस्ट लास्ट 5-6 days बिफोर जब शी पास्ड ड्यूरिंग द कोविड टाइम बिकॉज ऑफ कैंसर, तो उस टाइम पे जब हमें पता चला कि बीमारी इस लेवल पे पहुंच सकी है कि अभी हॉस्पिटल में कुछ नहीं होने वाला है, तो सोचा गया कि चलो घर जाते जो होगा अभी घर पे होगा. उसने तो लिविंग विल भी बनाया था कि उसको अगर ऐसा कुछ हो तो उसको इंट्यूबेट वगैरह नहीं किया जाए, जस्ट प्रोलॉन्गेशन ऑफ लाइफ.
करेक्ट.
तो लास्ट 6 दिन में जब हम उसे घर लेके गए, जब सबको पता था कि अभी बस टाइम आ गया है, तो उस टाइम पे हमने हमारा फाउंडेशन लॉन्च किया, स्प्रिंकल्स कैंसर केयर फाउंडेशन.
Sprinkles Cancer
Care Foundation.
Okay.
The purpose of this foundation was to help every patient of cancer.
Okay.
और ज़रूरी नहीं कि खाली गरीब पेशेंट को ही ज़रूरी पड़ता है. मिडिल क्लास पेशेंट्स को भी थोड़ा थोड़ा फाइनेंशियल असिस्टेंस लगता है.
Okay.
क्योंकि इट्स ड्रेनिंग, इट्स फाइनेंशियली वेरी ड्रेनिंग. तो हेल्प एनीवन हु कम्स टू अस. तो अभी काफ़ी लोग, इतने दोस्त हैं, मेडिकल ऑन्कोलॉजिस्ट, मेडिकल सर्जन्स, तो जिसके पास से रेफरेंस आया, जो हमारी कैपेसिटीज था, तो थोड़ा थोड़ा करके वी स्टार्टेड प्रोवाइडिंग फाइनेंशियल असिस्टेंस फॉर कैंसर पेशेंट्स.
ओके.
किसी को सर्जरी के लिए, किसी को रेडिएशन के लिए, किसी को कीमोथेरेपी के लिए. कुछ फ्रेंड्स के पेट स्कैन सेंटर्स थे, तो हम लोग या तो सब्सिडाइज पेट स्कैन्स या फ्री पेट स्कैन्स भी करते हैं. थोड़ा मेंटल हेल्थ काउंसलिंग फॉर कैंसर पेशेंट्स थ्रू 1 or 2 काउंसलर्स, साइकियाट्रिस्ट फ्रेंड्स आई हैव. किसी पेशेंट को सेकंड ओपिनियन चाहिए, टॉप ऑन्कोलॉजिस्ट की देख अफोर्ड नहीं कर सकते या पहुंच नहीं पाते हैं, तो फाउंडेशन उसका भी केयर करता है. तो हर जगह पे वेयर कैंसर के स्टेप्स के अंदर हम हेल्प कर सकते हैं, वी आर ट्राइंग टू डू दैट. जैसे जैसे टाइम बढ़ता गया, लोग जुड़ते गए, फ्रेंड्स, फैमिलीज, कोई पेशेंट्स, कैंसर सर्वाइवर्स ने अपने तरफ से कंट्रीब्यूशन दे के आज 5 साल हो गए हमारे फाउंडेशन को. वी हैव बीन एबल टू हेल्प अराउंड 650 कैंसर पेशेंट्स टिल नाउ.
Wow, that's brilliant.
राइट. वी डोनेटेड अराउंड 50-60 lakhs टिल नाउ.
Okay.
एंड आई गेस कि धीरे धीरे जैसे जैसे टाइम बढ़ता जाता है, पीपल आर नोइंग अबाउट अस, पीपल नो कि क्यों चालू किया है, तो आई गेस ऑटोमेटिकली लोग जुड़ना शुरू हो गए हैं.
करेक्ट.
तो हर हफ्ते 5-7 पेशेंट आते हैं. एंड जब मैं पेपर देखता हूँ तो मेरे को पता चलता है कि 50,000 का ट्रीटमेंट के लिए अंदर भी लोगों के पास पैसे नहीं है. लोग वेस्ट बंगाल, बिहार वगैरह या इंटीरियर से आते, जिधर उनका मंथली इनकम ही 5,000-6,000 है. सो आई गेस कि जो अपने रूप में कैसे कर सके, आई गेस दैट इज़ वेरी इंपॉर्टेंट.
सर, लेकिन अभी मानो कि कुछ लोग ये पॉडकास्ट देख रहे हु देमसेल्व्स आर, लेट्स से, सफरिंग फ्रॉम कैंसर, या तो दे नो अ फ्रेंड और अ फैमिली मेंबर, दे वांट टू गेट इन टच विथ यू. दिस इज़ अ वेरी नोबल थिंग आप जो कर रहे हो, और आपके फाउंडेशन तक उनको एक्सेस चाहिए, तो कैसे करें? हाउ शुड दे कॉन्टैक्ट यू?
So they can directly contact me. Abhi tak I still keep myself single point of contact.
ओके.
So they can reach out to me on my mobile number.
Correct.
And they can come to my consulting room at Bombay Hospital, room number 212
Okay.
with their documents. And normally 4-5 दिन में they get the check.
Okay. Perfect. So, sir, सबसे पहली बात तो on behalf of DTalks with Dr. Kapil, we would like to offer our condolences to what you and your family went through. लेकिन सर आपका स्टोरी सुन के जो एक शब्द जो मेरे मन में आते हैं, दैट इज़ इंस्पिरेशन. I think your wife has had a very inspiring life. It's not only restricted to herself, her own inner circle, लेकिन ये story सुन के there are so many people who will now get inspired कि a person who's going through cancer, who's going through advanced rare cancer, but still managing to attempt to dance, walk, वो नहीं हो पा रहे तो sing, वो नहीं हो पा रहे तो to become a critic, and finally, when all of this was up, to open a foundation to help so many different people. So probably one person has inspired, so many people to get help, and motivated you to start this foundation. We are really grateful to you to come and share this story, and it is very magnanimous of you to come on this platform and to share this story. Thank you so much, sir.
So I would just like to make a small thing. So the motto is every life matters.
Okay.
So that was the main principle कि whatever हम help कर सके हर life में, that is the point, and we can reach out to most of the people.
Okay.
And we always take her loss as an inspiration. We never cry about her loss, our loss. She's always a part of our lives as a happy memory, and we know कि हमेशा है, and with her blessing the foundation will always grow.
And we wish you all the best, sir, for that.
Thank you,
I
Kapil.
mean, जैसे इंस्पिरेशन, जैसे उन्होंने अपना मोटो बोला, वशिष्ठ भाई, नाउ आई जस्ट शिफ्ट द कॉन्वर्सेशन टुवर्ड्स यू. आप तो अभी एक ऑन्कोलॉजिस्ट हो, तो शायद से जैसे कपिल सर का स्टोरी आपने सुना, ऐसे प्रॉब्ली आप दिन में 10, 15, 20 पेशेंट्स आप देखते हो. हाउ डू यू मेंटेन योरसेल्फ? हाउ डू यू मैनेज योरसेल्फ? और यू थिंक इट जस्ट बिकम्स एन इंट्रिंसिक पार्ट ऑफ एवरी ऑन्कोलॉजिस्ट्स नेचर?
No, so honestly, Kapil, I have 2-3 cross disconnects with few terminologies that we very, very commonly use. Number one terminology that we use is cancer survivor.
करेक्ट.
आपके पास टीबी के पेशेंट आते हैं,
हाँ.
आप उनका इलाज करते हो.
हाँ जी.
When they come back to your clinic, आप उनको टीबी सर्वाइवर कहते हो.
नहीं, आई विल ट्रीट देम एज नॉर्मल एज पॉसिबल.
Precisely. So unfortunately, we believe कि अगर आज आपको कैंसर हो गया तो आप मरने ही वाले हो, और अगर आप गलती से नहीं मरते हो तो आप कैंसर सर्वाइवर कहलाते हो.
एक्चुअली मैं कभी ऐसे सोचा ही नहीं. यू आर राइट.
So we assume that you were programmed to die, but fortunately you are lucky enough to be alive, and hence I will now call you a survivor. While it is inspirational to a lot of people to be called a survivor, but then that also makes you want to believe that you are lucky to be alive. For this, let's take a very quick detour and understand why this entire concept has come about. In the late 1960s and 70s, nobody took cancer seriously. है ना? In the largest multi-speciality hospitals of the world, cancer was largely a pathology disease. मतलब जब कोई इंसान मर जाता था और उसके डायग्नोसिस होती थी ऑर्गन्स में, हाँ यहाँ पे कैंसर दिख रहा है.
Okay.
And it was relegated to the basements of large hospitals in the West. And it was not an illness that people even bothered about. There were a lot of cancer crusaders who wanted people to take the entire disease seriously so that there is some funding, so we understand the disease better, we find out better ways to diagnose it, better ways to treat it. And the only way to promote the disease was to make it sound lethal. And hence there was a big headline in New York Times that cancer kills. And in 1960s and 70s, that cancer kills was promoted heavily to ensure that the regulatory authorities start taking this disease seriously, which culminated into creating those national cancer grids in the West. There was a lot of investment into diagnosis, into awareness of cancer. Now, historically, from the 1960s, there has been a giant leap in our ability to understand how cancer works, how cancer is diagnosed, and how now today about 80% of all cancer patients who are ever diagnosed are cured.
80% is a huge number.
All
Wow.
cancer patients are ever diagnosed or cured. I'm talking about putting all cancer patients, irrespective of the stage, together. And it's not uncommon for advanced cancer patients also to remain well controlled for years. So an advanced cancer in a lot of diseases is now becoming more of a chronic illness.
Correct.
You cannot be cured of diabetes, but you can live with diabetes for years, maybe even decades. Similarly, in chronic cancers, certain chronic cancers, stage 4 cancers, it's not uncommon for people to live with the illness for years, maybe even decades. As Kapil Bhai was mentioning about his story, melanoma. In 2010, if one was diagnosed with melanoma, the life expectancy was 3 months. From
And
3
this is 5
months
years.
to be able to live 5 years of a reasonably grateful life is something that today's science has helped us achieve. And who knows, in the next 2 decades, it may be significantly more. So I think let's stop calling our people who have been cured of cancer as survivors.
Correct.
Cancer is a very integral part of your body. It's a very integral part of your organogenesis. जैसे आप evolve होते हो, you develop a thumb, you develop good genes, you develop certain bad genes also. And the basic process of you evolving to a next skill set, there could be certain rogue cells which are a part of your own system which misbehave.
Okay.
Now, our body has a phenomenally complex ecosystem to diagnose and kill these rogue cells. But occasionally, our body makes mistakes. And these mistakes could be driven by certain abnormal gatekeeper genes, जिनकी responsibility है ये mistakes को पकड़ना. वो बहुत बार गलती करते हैं and let these rogue cells end up eating away organs, which is cancer. Or maybe it could be an exposure of various environmental factors that some of which you may have control over, most of which you may not have a control over, which accrue in your body and eventually lead to cancer.
Got it. सर पहली बात तो आपने बहुत अच्छी तरीके से बोला कि कैंसर सर्वाइवर नहीं बताना है. एंड आई थिंक 1960 से आपने जो स्टोरी स्टार्ट किया, अब तो 2025 है, तो बहुत ही ज़मीन आसमान का डिफरेंस हो गया. और मुझे पता नहीं था that 3 months was probably the survivor of melanoma in 2000. Right now,
Exactly.
listening
so
to your story,
so we were told 6 months.
Yeah,
Imagine.
precisely.
We were told 6 months.
आई थिंक ये एक स्टोरी बहुत इंपॉर्टेंट है क्योंकि कभी कभी जब सर्वाइवर आपको बता देते हैं, बट विद द करेक्ट मैनेजमेंट, करेक्ट ट्रीटमेंट एंड बीइंग पॉजिटिव, it can really push life further.
So,
But
just a small thing. So the first time when we went to US to take one more opinion, so the first opening statement by the oncologist was there, which I felt very bad about at that time. He's like, "You're still alive." Now when I look in retrospect, I realized why he said that. So like he also said ki, the survival is 3 months, 6 months. So that's what I'm saying. So with इतना सारा treatment options available and how they are helping out their patients, I guess we have to have a positive perspective. Cancer is not the end of life.
it's just probably a bump. You can always go
It's a
ahead. I think
detour.
वो एकदम perfect है. But ये फिर भी मैं बोलूँगा कि statement कभी कभी आपको ऐसे patients और जो patient के जो relatives है, you have to have a certain level of sensitivity. You're still alive करके, मतलब I don't know, you'll still need to have.
I agree. So unfortunately, again, cancer has been relegated to being assumed that if you have this disease, and that is why the what you rightly mentioned, and Kapil Bhai also had a fantastic comment on it, that families are not comfortable discussing cancer. Because we are programmed to believe कि अगर इंसान को पता चल जाता है कि उनको कैंसर है, तो ये मानने लगते हैं कि अभी शायद मेरा समय कम है और मुझे I have females who are 25, 26, 28-year-olds with a 1 centimeter breast lump. The moment they are diagnosed, they believe it is the end of their life. And I do not blame them, because that's how historically we have treated cancer and cancer patients as a diagnosis and as a disease. Unfortunately, cancer does not affect human beings, it affects families. As Kapil Bhai mentioned that it's not that human being, but the entire family's life clock which stops.
Correct.
We strive very hard to prevent that from happening as cancer physicians now. Yes, it's a diagnosis. Some things are controllable if it's a tobacco-related cancer, smoking-related cancer, but a lot of it is now uncontrollable in terms of how they're diagnosed. How do we deal with this diagnosis? How do we sit down, plan our life, understand कि diagnostics में क्या क्या लगता है, therapy में क्या क्या लगता है, how will I arrange my entire process as during my therapy is so important. And it's very important for your oncophysician or your oncosurgeon to sit with that patient during the first diagnostic episode when they meet each other and give them a bird's eye view of what to expect in the next 6 months to 1 year.
And this bird's eye view is not only important for the patient but for the entire family. जैसा
For the
आपने
whole
बोला कि
family.
कैंसर जो पूरा फैमिली अफेक्ट हो जाता है.
Absolutely.
As we obviously heard the story. But one very important thing जो आपने बताया कि you had a 20-25-year-old with breast lumps and breast cancer है. सर ने भी उनका स्टोरी बताया कि 32 के उम्र में सर's वाइफ गॉट डायग्नोस्ड विद कैंसर. सो ये आप एक जनरल ट्रेंड देख रहे हो सोसाइटी में कि कैंसर हैज बिकम यंगर? बिकॉज हमारे मन में ऐसा ट्रेडिशनली है कि लेट 60s अर्ली 70s जब उम्र हो जाता है तब कैंसर की बीमारी है, लेकिन आजकल इतना यंग पेशेंट्स आप देख रहे हो वाकई में?
So yes, Kapil, we see that cancer is now affecting younger people. It is crossing boundaries. Previously, ऐसा माना जाता था that cancer was a disease of the old and the elite.
Yes,
है ना?
elite.
Because you would be probably a smoker of a certain type of cigar, and you've lived your life and you're in your 70s and you'll be diagnosed with lung cancer. That was really the norm 30-40 years back. What we have seen now that cancer is a great leveler of life. It does not differentiate between caste, creed, age, sex, financial status. Today you may be the happiest person in the world, on top of the world, and tomorrow you may have a vague symptom of some blood in stool and some GI discomfort, and you could be diagnosed with a stage 3 colon cancer. So cancer is a great leveler, and yes, we do see a great transition in people being diagnosed early. This could still be a very complex interplay between both your gatekeeper genes and your environmental exposures. Maybe what we eat today, maybe the stresses that we live in today, maybe the sedentary lifestyle that we have today may have an impact on how your gatekeeper genes are being able to protect your body against these carcinogens, and it is not infallible. So the more stresses that your physical body goes through, which it is not supposed to, be it dietary, be it the air you breathe, be it the food that you eat, be it the amount of quantity of exercise that you have, will determine eventually your likelihood of developing cancers.
सर आप अभी ये सारे जो फैक्टर्स आप बता रहे थे, अगर मैं आपको एक सिंपल क्वेश्चन पूछूं कि कैंसर का रिस्क फैक्टर्स आज के ज़माने में क्या है, एंड अकॉर्डिंग टू यू व्हाट आर द टॉप 3 रिस्क फैक्टर्स फॉर द डेवलपमेंट ऑफ कैंसर?
So, Kapil, there are 3 buckets है ना of carcinogenesis. एक जो genes that you are born with,
ओके
वो आप नहीं बदल सकते हो,
ओके
and they contribute to about 15% of all cancer patients. So if I divide this in terms of 100 patients, 15% of these cancers are because of the genes that you are born with. It is something that you cannot modify it.
ओके
The other bucket is your lifestyle. And when we talk about lifestyle, it includes your physical activity. There is a beautiful paper in NEJM, New England Journal of Medicine, which says that if you are 45 to 50 minutes a day physically active, which includes walking, and not just walking, jaywalking, but getting involved in a significant planned 45 to 50 minutes of physical activity, you reduce your lifetime cancer risk by about 25%.
That's a huge reduction, 25%.
Yes, absolutely. So physical activity is a very, very important way to prevent cancers. So lifestyle becomes, and also the air that you breathe. I'm sure I'm in the middle of 2 elite pulmonologists, so I cannot stress more on the importance of breathing the right air. And smoke, be it primary from any form of smoke, or secondary in the form of you sitting with a smoker or sitting in a room full of hookahs, is carcinogenic. The air pollution, again, that we are exposed to is carcinogenic. Also, what we eat is extremely important in defining your probability of developing cancer. आप जैसे कह रहे थे कि cancer is it a new phenomena? Though cancer is 5,000 years old, but you see and hear cancer far more often than what you would have heard in few decades back. It could also be because of earlier diagnosis, and you see more people being cured of cancer, and hence there are more people around who've had cancer in their lives, but also it is because of what we eat.
Correct.
A wise man once very beautifully said that everything that grows on a plant is not carcinogenic, and everything that grows in a plant is potentially carcinogenic.
Lovely, lovely.
So जो ईश्वर ने बनाया है, भगवान ने बनाया है, अगर वो जब बनाया है तभी आप वो इस्तेमाल करते हो, इट इज़ नॉट कार्सिनोजेनिक. अगर जो ईश्वर ने आज बनाया है वो आप 1 साल के बाद खाना चाहते हो, उसको प्रोसेस करके उसमें एक्स्ट्रा सॉल्ट डाल के उसको यू आर ट्राइंग टू मेक दैट प्लांट लिव अननेचुरली फॉर अ वेरी लॉन्ग पीरियड ऑफ टाइम, it's when you are potentially exposing yourself to a risk. You're eating what you should not eat, right?
आई थिंक वेरी इंपॉर्टेंट है. तो मैं अगर शायद से ये पॉडकास्ट के बाद अगर मैं जाऊंगा तो आपने ये जो स्टेटमेंट बोला दैट शुड बी लाइक द टेक होम
आपके
मैसेज.
सामने जो प्लेट में है
यस.
वो कब बना था और ये कैसे बना था. अगर ये कोई प्लांट में बना हो, प्रोसेस्ड हुआ हो, मैदे का हो, फुल ऑफ स्टार्च हो, इट इज़ एक्सपोजिंग योर सेल्फ टू अ सर्टन रिस्क ऑफ not just cancer, obesity, heart illnesses.
कंप्लीटली अग्रीड. बिकॉज फूड और कैंसर का भी आपने इतने ब्यूटीफुल तरीके से आपने एक्सप्लेन किया कि देर इज अ कोरिलेशन. वी हैव गॉट 2 videos which we want to show everyone, and then based on these videos I would just like to ask you. ठीक है? So let's see the first video.
I've been talking about this for 40 years, all right? And I have seen hundreds and thousands of people who just become healthy and well simply because they're not fueling up all the time when the tank is filling.
She discovered that cancer loves. And we need to know what cancer loves so we can stop it. We also need to know what cancer hates, because we want to give it, is that right? She discovered that cancer loves sugar. The fact is that a cancer cell consumes 15 times the glucose of any other cell.
वशिष्ठ भाई, ये 2 वीडियोस जो देखा, इट्स दोनों आप अगर देखोगे, पहले वीडियो में सदगुरु कैसे एक्सप्लेन किया कि इंटरमिटेंट फास्टिंग जो आजकल का फैड हो गया है, सो अपेरेंटली एंशियंट इंडियन विजडम ऑलवेज हैड इट. दिन में 2 बार मील्स खाना, जैसे आपने बोला, ऑन अ प्लांट इन अ प्लांट. ओके. सेकेंड वीडियो यू सॉ, नो दिस इज ऑल्सो अ वेरी कॉन्ट्रोवर्शियल प्रोफेसर, यू नो, शी हैज़ anti-pharma and you know a lot, if you see other videos of her also, but she mentions one thing which is a huge rage nowadays कि cancer cells का जो growth है is completely dependent on sugar. So logic says that you stop your sugar, therefore you are stopping the chance of cancer. Now from an oncologist I want to hear this कि क्या ये assumption जो मैंने किया ये सही है कि you think there are more layers to this?
No, so आपने जो किया वो absolutely you put it right. It's an assumption and hence unfortunately a myth.
Okay.
Because if just stopping sugar could prevent the cancer from growing, then the simple treatment for all cancer patients should have been कि आपने sugar बंद कर दिया, कैंसर बेचारा मर जाएगा because उसको खाना मिलता नहीं है. That defies the basic definition of what a cancer cell is all about. जब आप खाना कम देते हो तो आपकी जो नॉर्मल सेल्स है वो अपने मेटाबॉलिज्म स्लो कर देते हैं और वो कीटोजेनिक स्टेट में चले जाते हैं.
Okay.
है ना. इसीलिए यू स्टार्ट लूजिंग वेट एंड यू स्टार्ट ईटिंग अप योर फैट एंड इवेंचुअली योर मसल. कैंसर बाय डेफिनेशन इज अ रोग. इट इज नॉट सपोज टू बी बिहेविंग लाइक अ नॉर्मल सेल. सो आप नहीं खाओ, कम खाओ, ज़्यादा खाओ, it has absolutely, it is not worried. It has already found out ways and means to become amar.
Okay.
It is, I almost romanticize that cancer is a better version of your own self. It's the X-Men because it has found ways and means to stay alive, irrespective of what your nutrition is, of how you try to define it. And it's a thinking cell. So irrespective of the quantum of sugar that you have, yes, in general, sugar is not a healthy thing to eat for anybody. More specifically, refined sugar, because
Okay.
it is pure carbs, it is not adding to any muscles, and it is not helping you as a person. Again, the same on the plant, in the plant theory. But if you believe that if you stop cancer, if you stop sugar, you are going to prevent your cancer from spreading, that's a myth.
Okay.
So yes, excess amount of sugar is definitely harmful because it helps you, it makes you more obese.
Got it.
And obesity helps in a lot of hormone cancer cells to promulgate further. So in breast cancer, in ovarian cancer, in endometrial cancer, obesity is an absolutely known risk factor. Now the problem with generalization is that when we look at these videos, and if you are a patient who's undergoing cancer therapy, you freeze to death यू बिलीव कि कल तो मैंने वो मिठाई खाई थी और आज मेरा कैंसर बढ़ने वाला है.
आई नो. और इंडिया में मिठाई के बिना तो यार नहीं रह सकते.
हाँ, कैसे रह सकते हो. सो अनफॉर्चुनेटली मिठाई खाने से कैंसर बढ़ता नहीं है, लेकिन आप कैंसर का आप अगर शुगर का सेवन कम करते हैं तो आप ओबीस कम होंगे, तो आपको हार्मोन रिलेटेड कैंसर अगर आपको डायग्नोसिस हुआ है उसकी प्रोबेबिलिटी कम हो जाएगी और उसका प्रोग्रेशन थोड़ा स्लो ज़रूर हो सकता है.
ओके.
सो लेट्स नॉट जनरलाइज कि आपने कैंसर खाया तो कल आप शुगर खाया तो कल आपको कैंसर हो जाएगा.
ओके.
The other thing that unfortunately is again a huge rage is cancer nutrition. It unfortunately has become a huge business in India and all parts of the world, where people give you beautiful, nice, predefined dietetics in terms of having some amount of extra omega-3, आप ये खाओ वैसे खाओ, and they are told that if you follow this diet, we are going to be able to cure your cancer. It's again as romantic as the word cancer itself. अगर आपको लगता है कि आप 2 सुबह नीम के पत्ते खा लोगे, रात को 4 बजे उठ के वो ये जो हल्दी रहती है वो गर्म पानी में भिगो के पी जाओगे तो अगर आपका कैंसर चला जाएगा. I really wish it was true. Whenever I see these beautiful videos, I almost hope that they are true. Unfortunately, there is enough now scientific evidence to believe that cancer does not, the way it does not differentiate between caste, creed, it also does not differentiate between आप 4 बजे टर्मरिक खा रहे हो या 8 बजे टर्मरिक खा रहे हो. And unfortunately, they have not translated into meaningful change in their overall survival. In fact, there is a very scathing article in this year's American Society of Clinical Oncology guidelines where they have mentioned that people who are on certain superfood diets, very high amount of anti-inflammatory, antioxidants, high doses of vitamin C, vitamin E, vitamin D, and if they were randomized to people who are not following these diets, the outcome of these patients was actually poorer compared to the ones who were having a normal routine diet, which obviously was devoid of, as I mentioned, heavily processed food, heavily processed meat, and who were physically active.
So I think cancer nutrition, जैसे सर ने बोला, and it's become a huge business. So I think it's better to stick to basics, जैसा आपने बोला, you know, that statement which you made, and processed food avoid करना या तो कम करना obviously is the way forward. सर आपको मैं पूछना चाहता हूँ, सर आपके केस में were you also told certain things that you need this particular protein powder, you need this timing of, you know, let's say food, आपके वाइफ के केस में?
So हर बंदा जो आता है अपना, इंडिया में हर बंदा डॉक्टर को छोड़ के सब नॉलेजेबल है.
करेक्ट.
तो सबका कहना ये खाओ वो खाओ ये खाओ वो खाओ, इससे कैंसर. तो प्रॉब्लम क्या होता है कि जो लोग उसको प्रोसेस नहीं कर सकते वो कितनी बार सोचते हैं कि कैंसर का ट्रीटमेंट छोड़ देते हैं हम और इन सब चीज़ों के ऊपर ध्यान देना शुरू कर देते हैं. और काफ़ी बार हमने देखा गया है, ये तो ज़्यादा देखते होंगे, पर टीबी में भी ऐसा होता है, कैंसर में भी ऐसा होता है कि एवरीवन वांट्स टू फाइंड एन ऑल्टरनेटिव. और इसी कारणवश 2-3 साइकिल लेने के बाद वो अपना ट्रीटमेंट छोड़ के ये सब सुनी सुनाई बातों के ऊपर कॉन्सेंट्रेट करते हैं और उसके बाद उनका कैंसर जो कंट्रोल में आ रहा होता है वो प्रोग्रेस हो जाता है.
That's a very unfortunate reality actually जो सर ने बोला.
न्यूट्रिशन, यस, खाने पीने पे, बट मेरे हिसाब से नेचुरल फूड्स अपने इतने ऑप्शंस अवेलेबल हैं. जैसे जैसे आपका कैंसर ठीक होता जाएगा आपका एपेटाइट इम्प्रूव होता जाएगा और ऑटोमेटिकली योर न्यूट्रिशन विल स्टार्ट इंक्रीजिंग. तो बेसिक फूड्स के ऊपर कॉन्सेंट्रेट करना, जो नेचुरल फूड्स है, आई गेस इज ऑलवेज बेटर देन टेकिंग टू मेनी आर्टिफिशियल सप्लीमेंट्स.
करेक्ट, अंडरस्टूड. That's a very important point जो आप बता रहे हो.
In fact, I completely agree. In fact, it's not uncommon, and I'm sure Kapil Bhai would have seen in his practice. You have people who are doing very, very well. You know, they have been diagnosed with certain, maybe an advanced cancer. आपने treatment चालू की. They're following their routine lifestyle, nutrition changes जो आपने suggest किए हैं. And then suddenly one fine day, they stop coming. And they come back after 6 months, having lost 25 kgs of weight, having lost all their muscle mass, massive weight loss, and extensive spread in the disease. Because one smart aleck, one important relative told them कि यार ये सब छोड़ो, मेरे पास ये आयुर्वेदिक प्लांट है, ये आप दिन में 3 बार खाओ, आप घी मत खाओ, आप शुगर मत खाओ, आप मिल्क मत पियो, just be on maybe 2-3 fruits और certain extremely frugal diet. और आप जैसे खाना बंद कर दोगे आपके कैंसर को खुराक ही नहीं मिलेगा. And you see these patients come back at a stage where we are not able to offer them a basic routine treatment also because they are so fragile and so frail.
It's very tragic actually अगर आप सोचोगे तो, but unfortunately we live in an era of branding and marketing and advertising. Unfortunately some things work, some things cater to the people, they leave their
So, Kapil,
chemo and all of that.
in fact when a lot of people tell me कि मैं किसकी सुनूं, मुझे मेरे ये रिलेटिव कह रहे कि ये खाओ, मुझे मेरा भाई कह रहा है कि ये खाओ, मुझे मेरी वाइफ ने बहुत सारा इंटरनेट पे, फेसबुक पे, इंटरनेट पे पूरा डायग्नोस करके मेरे लिए एक परफेक्ट डाइट बनाया है. एंड आई ऑफन आस्क देम दैट हाउ लॉन्ग डिड योर ग्रैंडफादर लिव, and if they tell me that their grandfather was alive till 85, I tell them, you speak to anybody who knew your grandfather very well, or if he's still alive, and ask him what he's doing in his daily routine. And that is the way to live. He gets up early, he does not have 4 बजे उठ के गर्म पानी में उबलाया हुआ कुछ नया नीम का पत्ता. He does his prayers, he goes for his routine walks, he has a reasonably comfortable normal breakfast, he does not eat out, he does not have processed food, he sleeps well in time, he is not stuck to his phone, he probably does not use the Instamarts of the world to prepone happiness and immediate gratification के लिए. He still goes to the bank and submits a check and does not do online banking.
Correct.
He still probably does not use a remote for smallest thing like opening curtains and opening doors.
And fans nowadays.
And fans. So while we want things quicker, we're also getting cancer quicker as a gift.
Wow, I think that's one more very important thing. हाँ, आजकल तो सब 10 मिनट का ज़माना है, आपको 10 मिनट में हर एक चीज़ चाहिए, डिलीवरी बोलो, whatever. So we are unfortunately compromising. Our lifestyle has become very sedentary. And you're right. I think we should learn a lot from our forefathers what they used to do and try to adopt these positive things.
सबसे नेगेटिव थिंग है कि पहले ऑर्डर करना पड़ता था और 9 बजे के बाद कोई आता नहीं था. अभी रात को 12 बजे, 1 बजे, 2 बजे also you're ordering processed food, it comes. So I guess this is something which is
It's a massive point. You have access to having have a huge cake at 2 o'clock in the night.
Exactly.
In 10 minutes on Instamart or which are one of these quick grocery websites.
Correct.
रात को 2 बजे कौन किसी को आप उठा के ये बनाने वाले थे?
Exactly.
So sometimes not having access is a boon. Now in this madness of having access to everything at the click of a button, we'll have to learn to rewind, unwind and unlearn.
So I think the side effects of social media भी थोड़ा ये है
Except listening to this podcast.
नहीं, detox with Dr. Kapil important है यार, detox करने के लिए वो तो important ही है. सर अभी नेक्स्ट में आपको एक पेशेंट की तरफ से मैं आपसे पूछना चाहता हूँ कि कभी-कभी if you could broadly tell us that what are the first few signs that a person undergoes that should be a very high suspicion for cancer?
Yeah. So any painless lump which is there in your neck or in your chest wall, in females more specifically breast, which has been there, it is hard to touch and it is increasing in size over a few weeks. You might have gone to your family physician, he might have given you a course of medicines and it does not come under control. Could be abnormal. In females, uncontrolled bleeding at not the right times. For example, you're used to having a certain cycle and then you continue to bleed and you do not have menorrhagia, then this could be an early sign of endometrium or an ovarian tumor.
Okay.
You have achieved menopause, आपका period बंद हो चुका है. उसके बाद भी if after 5 years, 10 years, you may have episodes of bleeding, that also is considered as abnormal. Unplanned weight loss is abnormal. Passing blood in stools is abnormal.
Okay.
If you are used to passing stool 3 times in a day and suddenly you're constipated and you pass stool twice a week, it is abnormal. If you're used to be constipated and suddenly you have low-grade diarrhea which lasts for more than a few weeks, it is abnormal. If you're coughing and you're coughing relentlessly more than a few weeks, it is abnormal. If you have blood in your sputum, it is abnormal.
So there are so many things, different system. But ये सारे जो आप बता रहे, it's the first thing. But
very broadly,
मानो कि let's say there is a 40-year-old male or a female who's watching this podcast, absolutely fit and fine. आप जितने भी symptoms बोल रहे हो उसमें से एक भी symptom नहीं है. फिर भी क्या आपको लगता है कि ऐसे लोग को एक स्क्रीनिंग करना चाहिए अपने बॉडी में just because आपका उम्र हो गया है, और you would want them to probably have some of these symptoms and then go to a doctor?
So the definition of screening itself means that you do not have symptom, Kapil.
Okay.
You screen people who do not have symptoms. People who have symptoms go to a doctor. The fun is in preventing cancers.
Correct.
At the same time, you don't want to be paranoid about, looking, scouting, and I have had people who are at the age of 40 keep on doing PET scans every 6 months because they feel कि नहीं कुछ cancer हो तो मुझे तुरंत पता चला जाए. Yes, cancer is common, but it's not so common that it affects every human being in their lives. The current guidelines which we tend to follow is if you're a female and if you have touched 40, then you should invest in doing an annual mammogram. I often tell them that do it in your birth month. If you're born on 10th of July, every July get yourself a mammography done, get yourself a pap smear done. These two are the cancers which can be diagnosed, cervical cancer and breast cancer, very, very early and in the absence of symptoms. And a stage 1 breast cancer has a more than 95% chance of remaining alive without cancer for eternity till the time that they are supposed to be alive.
Correct.
Similarly, the survival of a stage 1 cervical cancer is more than 90%. So for females, it should be getting a mammogram done and also a pap smear done after the age of 40. If you have had a family member who's been diagnosed with cancer, then you screen yourself 10 years for that cancer before their age of diagnosis. For example, if you have had your mother who's had a cervical cancer or breast cancer at the age of 50, you screen yourself at 40. If they have had it at 48, you screen yourself at 38. So it should be 10 years before a patient in your family who's ever had cancer.
Okay.
Apart from that, for males, the recommendations are to do prostate-specific antigen, which is a PSA level after the age of 60, and a stool occult blood, or now another test which is called as fecal antigen, to be done after the age of 55 once in a year. The US also recommends that after the age of 55, you should do colonoscopies once in 5 years.
Okay.
This is for the general public at large. Then we specifically talk about at-risk populations. For example, chronic smokers, heavy smokers. I'm sure you would have told enough people around that maybe low-dose CT scans at frequent intervals is going to help you diagnose cancer early. I'll just use this opportunity to touch upon the topic of non-smoker cancers, which is a very, very unique Asian phenomena.
And which we are seeing on a rise actually,
Massively
non-smoking
on a
cancers.
rise.
Yes.
And while they are extremely upset when they see us that, Doc Saab, I have read enough. It is the smokers who deserve to have lung cancer. I've never smoked. I've never had exposure to smokeless tobacco. How the hell I have been diagnosed with cancer? But the silver lining in that cloud is that almost 40 to 50% of Indians who are non-smoker cancers, they have a mutation-driven malignancy. So there are certain mutations that we test for in their biopsy, EGFR, ALK, ROS, MET, PDL1. And there's about a 40 to 50% chance if you're an Indian or an Asian to be having these mutations. And these mutations have simple oral tablets by which you can control their cancers for years, if not decades.
Okay.
Now, why I mention this is an Asian phenomena? Because the same non-small cell, non-smoking lung cancers in the West, the incidence of this mutation is a paltry 10 to 15%. While in India, in Southeast Asia, in Japan, in Korea, it's about 40 to 50%.
That's a huge, three times
Three times more, and very simple cancers to treat. I know so many doctors who currently are taking these pills and operating 6 hours a day, 8 hours a day, seeing patients, and they live a beautifully normal life.
Okay. तो but देखो आम आदमी की तरफ से they will not know mutations. आपने जो नाम लिया है कि जैसे EGFR है, ALK है, ये सब तो आम आदमी नहीं जानते.
जी.
But is it safe to say that whoever you are, अगर आपका बायोप्सी हो के कैंसर डायग्नोस हुआ है तो जस्ट एंश्योर कि ये म्यूटेशंस भी चेक होते हैं?
For the right patient, absolutely.
Correct. Okay. Sir, since we are talking about diagnosis, obviously biopsy is very important. और आपने बोला कि mutations भी for the right patient, for the right cancer is also important. लेकिन मुझे एक चीज़ आपसे पूछना था. बिगनिंग में जैसे सर ने बताया कि फ्रॉम अ केयर गिवर पॉइंट ऑफ व्यू थिंग्स आर वेरी इंपॉर्टेंट. आपके सामने अगर एक इंसान बैठा हो विद द एंटायर फैमिली, आपके हाथ में रिपोर्ट्स है कि दिस पर्सन हैज गॉट कैंसर, हाउ वुड यू डील विथ ब्रेकिंग द न्यूज़ and involving the family members also in the diagnosis and management?
So, I think I'll again go back to what Kapil Bhai mentioned at the beginning of the podcast, is that we as Indians have a habit of protecting the patient against the diagnosis if it's a bad diagnosis, है ना? If they feel that the diagnosis is going to be harmful for them in terms of their ability to process, हम उनको बताना नहीं चाहते हैं, which in the past might have helped a few people cope better, but it's unfair. I mean, I ask the relatives the first question कि अगर आपको ये बीमारी हुई होती तो would you be comfortable not knowing what you're suffering from? I think it's important that the discussion of cancer and cancer diagnosis is not across the table. We have to ensure that we are all on the same side of the table when we are discussing this.
करेक्ट
है ना? बहुत बार वो ट्रांजैक्शनल हो जाता है, बहुत बार वो एक हायर मोरल ग्राउंड ले लेते हैं डॉक्टर्स, फिजिशियंस, सर्जन्स कि आपके पास इतना आयुष्य है, आप देख लो अब ये करना है या नहीं करना है. इट्स ऑफन डायडैक्टिक. So yes, we do spend a lot of time in explaining what a cancer is all about, what is the stage of the cancer, what is the probability that you are going to be cured, what are the treatment options in case the disease is incurable. We focus a lot about ensuring that they understand the financial costs of diagnosis to treatment and the longevity of the treatment. We also ensure that बहुत बार there is something called as caregiver fatigue which sets in simply by the longevity, and बहुत बार वो थक जाते हैं कि बस सर अभी नहीं देखा जा रहा है, नहीं बेर हो पा रहा है. So we insist that we focus on giving them small breaks in between their treatment to ensure that everybody gets time out. कैंसर से जैसे मैंने पहले भी कहा कि सिर्फ पेशेंट की नहीं, पूरे परिवार का क्लॉक स्टॉप हो जाता है. They feel guilty of enjoying. For example, if somebody in my family is diagnosed with cancer, I feel guilty of taking vacations. I feel guilty to go out and watch a movie.
How true.
I think it's important to break that ice. है ना? Where we believe they almost feel guilty that somebody in their family is having that illness. हमने मांगा नहीं है, हमको किसी ने दिया नहीं है. Why don't we all come together, fortify our beliefs, and believe that cancer is a small part of my otherwise beautiful, utilizable life. Again, very rightly mentioned Kapil Bhai's journey of how they dealt with maturely, of being able to do what they wanted to do, of when your restrictions, physical, emotional, come into being, you still try and utilize your bandwidth to impact yourself, people around you, and the society at large, is how you're going to be alive. बहुत बार हम क्या करते हैं कि हम चाहते हैं कि क्वांटिटी बढ़े और क्वालिटी जो है वहाँ ही वहाँ रहे. I think it's important that both the quantity of life and the quality of life, the amount of time that you're alive should be the amount of time that you're utilizable to your own self and to people around you.
That's a very important statement आपने जो ending में बोला. Kapil sir, he used a very interesting term, caregiver fatigue. Would you say that आपका जो personal story है, आपकी journey में, you also went through this caregiver fatigue का phenomenon?
It's a natural phenomenon, no? आप रोज देख रहे हो, you cannot keep it in front of you all the time, but back of your mind पे तो वही चल रहा है कि आज कैसा था दिन, अभी बायोप्सी कराना है, ये करना है, वो करना है. एज ए डॉक्टर 10 लोगों को मिलते हो तो 10 बार डिस्कशन होता है. आपके पेशेंट से जो सब ठीक होके जा रहे हैं, एंड यू आर फेसिंग अ चैलेंज एट एवरी स्टेज. सो इट्स अ नेचुरल प्रोसेस एंड एवरी पर्सन गोज थ्रू दैट. अभी खाली कैंसर का ही नहीं लीजिए ना, अभी जब एल्डरली पीपल, जब किसी को स्ट्रोक आ जाता है और जो हॉस्पिटल में रहते हैं, एक महीना, डेढ़ महीना है, वेंटिलेटर पे है, ट्रेकोस्टोमी है. सो एवरी इलनेस विच इज लॉन्ग टर्म, एज अ पल्मोनोलॉजिस्ट, यू एंड आई, वी सी इडियोपैथिक पल्मोनरी फाइब्रोसिस, लंग फाइब्रोसिस,
करेक्ट,
उनका भी क्वालिटी ऑफ लाइफ, क्वांटिटी ऑफ लाइफ अफेक्ट होता है. तो केयर गिवर जिस भी क्रॉनिक डिजीज में है, तो फैमिली सपोर्ट एंड फैमिली फटीग आना स्वाभाविक है. सो उस टाइम पे टू मेंटेन पॉजिटिविटी, I guess, becomes very important. It's a very natural phenomenon for everyone.
True.
And I feel we are lucky in India because our family support is very strong.
ये भी point है.
काका, मामा, चाचा, नाना, there are so many people, relatives भी सब घर पे आ जाते हैं. कितनी बार हम जनरल वार्ड में देखते हैं कि पेशेंट डे के पर पूरा गांव का गांव आके रोज आके मिल के जाता है, विच पेशेंट को बहुत अच्छा लगता है कि मेरे को सब मिलने आए. अब्रॉड अपन देखते हैं कि कोई आ ही नहीं रहा है, वो एक स्पेशलाइज्ड केयर में है, कोई आता नहीं. तो आई गेस फैमिली केयर, फैमिली सपोर्ट इज़ वेरी इंपॉर्टेंट फॉर द पेशेंट एंड फॉर द केयर गिवर. व्हाट इज इट टू गिव अ ब्रेक, कि कोई दूसरी बहन आके रह गई तो आप 5 दिन छुट्टी लेके आ जाओ.
करेक्ट.
और एक पेशेंट को कैंसर है इसका मतलब नहीं है कि बाकी सबकी लाइफ खत्म हो गई है.
True. And I think जो आपने बोला, we are lucky that we are in India. You know, we've got a very strong social network. Families जो है यहाँ पे काफ़ी वो अभी भी socially हम काफ़ी साथ में, तो that really helps.
वो ताऊ जी नीम के पत्ते तो खिलाते हैं, लेकिन साथ में जो घर पे आके माहौल हल्का करके जाते हैं, तो दे बैलेंस द नीम के पत्ते विद a beautiful comfort of having people around, and the comfort that having people around gives is second to none.
Okay. इत्तेफाक से अभी since you mentioned about नीम के पत्ते, I want to talk about treatment of cancer. So first I want to talk about diet. So first let us have a look at this video and you will really love this video. तो ये पहले एक वीडियो देख लेंगे. सो वशिष्ठ भाई, ये तो बहुत ही इम्पॉर्टेंट वीडियो है. आप जानते हो कि अनफॉर्चुनेटली नवजोत सिंह सिद्धू's wife got diagnosed with cancer and this was a huge press conference which was held. You heard the entire routine, limbu pani,
नहीं, लेकिन कपिल, ये कॉमेडी विद कपिल से था कि प्रेस कॉन्फ्रेंस से
this
वीडियो
was an
था?
actual press conference obviously. So ये तो हुआ ही था. But see, this blew up into a huge storm. A lot of oncologists जो है like yourself were against this video, but a lot of natural practitioners were pro this video. There was a huge fight. Now I want to ask you a simple and a direct question.
Please.
Would you recommend this diet for all patients who are suffering from cancer?
So the answer is very clear-cut no, because there is enough evidence to believe that these pre-assumed notions are far more harmful than helpful. Also, on a lighter vein, I wish Sidhuji had focused better on cricket rather than becoming an oncologist, because from what I do know is that her wife has received standard of care treatment and she has received the required systemic chemotherapy and she has dramatically responded well to that treatment. It's unfortunate that at the end of everything, rather than lauding and respecting the entire effort that the team of oncophysicians did for her wife, we are only tom-tomming about and creating a press conference about these 3 additive factors which unfortunately neither the patient herself has promoted as something that has changed her life. So it's unfair that few celebrities try and stay relevant by doing something which is not their forte. अगर मैं कल सबको एक प्रेस कॉन्फ्रेंस बुला के बताऊं कि ये 3 टेक्निक है, अगर आप ऐसे क्रिकेट खेलोगे तो आप 100% वर्ल्ड कप जीतने ही वाले हो, तो ऑलमोस्ट ये ऐसा ही प्रोफेटिक हो गया है कि एक एक्स क्रिकेटर दुनिया को कैंसर कैसे ठीक करना है बताना चाह रहा है, विच इज़ ऑलमोस्ट अनफेयर. एंड एक्सेप्ट इंडिया, एनीवेयर एल्स इट वुड बी लीगली difficult to even for that person to be able to live a normal life. He would probably be behind bars for making such loud statements. But India is India and we take our celebrities very seriously. From कौन से सोप से नहाना है से कौन से टाइप का तंबाकू खाना है, and that's the harsh reality. And I hope wisdom prevails. For unfortunately an average patient ना, वो तिनके की तलाश में है. He is hoping that कुछ मैं एक्स्ट्रा ऐड करूँ जिससे मेरा पेशेंट बच जाए, जिससे मैं खुद बच जाऊँ, जिससे मेरा बेटा बच जाए. एंड उनको हम अनफॉर्चुनेटली मदद करने के जगह पे, वेयर वी शुड बी सेंडिंग देम टू द राइट पीपल हु वांट टू हेल्प, लाइक कपिल भाई रन्स अ ब्यूटीफुल फाउंडेशन, वी मेक द फादर गो टू अ मार्केट एंड गेट नीम के पत्ते एंड स्पेंड टाइम मेकिंग दिस काढ़ास. So with due respect to all the naturopaths, unfortunately who when they are diagnosed with cancer are the first ones to rush to an oncophysician, but very important that let lifestyle be a small but an important clog in your therapy, and do not let that be your telltale treatment for any disease, not cancer but in general any disease.
करेक्ट. बट देन जैसे आपने बोला वो तिनके की तलाश जो रहता है, पीपल जस्ट ट्राई टू सर्च सम सॉर्ट ऑफ वे कि मैं ये करूँ तो इम्प्रूव हो, ये करो तो हो जाता है.
तिनके की तलाश, तिनका वही सपोर्टिव है.
करेक्ट.
और प्रॉब्लम क्या होता है जब सेलिब्रिटीज़ एंडोर्स करते हैं तो लोगों को लगता है कि अभी इसी से ठीक होना है, और कितने अच्छे केसेस जो इतने इम्प्रूव हो रहे होते हैं सडनली गेट आउट ऑफ ट्रीटमेंट, एंड एज ए डॉक्टर यू फील वेरी बैड.
करेक्ट.
You feel very sad because it's not about anything. It's about, आपको लग रहा था सब ठीक हो रहा है, बीमारी खराब हो जाती तो फर्क नहीं पड़ता, पर बीमारी छोड़ दी इन चीज़ों के कारण, दवाइयाँ छोड़ दी, वो बहुत चुभता है.
Correct. And I think our celebrities need to take a lot more responsibility. We have so many celebrities who are openly coming in gutka and tobacco product ads and all. A lot of the youth are, affected by all of this. So I think they also need to take a bit more responsibility.
Absolutely. There has to be a vicarious responsibility for anybody who's promoting a known carcinogen, and people get away with this. It's very, very unfortunate in today's society that people get away with this. It's time that if you are in a position of power, if you're in a position of influence, you use it very, very wisely to help the next generation rather than only fill your own coffers by taking your endorsement fees.
Correct. And that is where I think a lot of such podcasts come into play, because we've got experts, and listening from these experts is actually what I would strongly recommend anyone who's suffering from cancer should do. Sir, diet तो हमने डिस्कस कर ही दिया, लेकिन सी देयर आर सर्टन टर्मिनोलॉजीज जो बहुत कॉमन है. कीमोथेरेपी, रेडियोथेरेपी, सर ने भी बोला कि रेडियोथेरेपी हुआ है, तो a lot of people have heard these terms, लेकिन एक आम आदमी की तरफ से अगर आप एक सिंपल एक्सप्लेनेशन दे सकते हो कि what do you mean by chemotherapy?
So basically कोई भी कैंसर, कपिल, को 3 बकेट में डिवाइड किया जाता है जब भी उसकी ट्रीटमेंट की ज़रूरत होती है. एक होता है उसको निकाल देना सर्जरी करके, जिसको सर्जरी कहते हैं. दूसरा होता है उसको जला देना, जिसको हम रेडिएशन कहते हैं.
Okay.
जब भी हम इस्तेमाल करते हैं यूज वर्ड जलाना, तो उनको लगता है कि कोई वहाँ पे आग लगा देता है, वो एरिया जल जाएगा. नी, दीज आर इनविजिबल रेस वेर इन यू गो टू अ लार्ज मशीन एंड इट टू द मिलीमीटर वेयर द डिजीज इज, इट कैन एक्चुअली मैप इट आउट and burn only the tumor to the smallest of the sub-millimetric specificity. It could be deep inside your brain, deep inside your spine, deep inside your cavity, and the rays can go. They are not colored. They are मतलब वो picture जैसे लाल rays वगैरह नहीं जाते हैं. It's you just walk into a large scan machine. Somebody will say you stop breathing for a second. The rays are there and you come out. That is radiation.
Got it.
Radiation is occasionally repetitive. You may need to undergo 5, 10, 15, 20, 25 sessions based on your diagnosis. Surgery is usually a one-time job where they remove surgically that part of the tumor and maybe nodes around it.
Okay.
Chemotherapy is a systemic treatment. जैसे सर्जरी और रेडिएशन आर लोकल ट्रीटमेंट्स. जहाँ पे बीमारी थी वो आप उसको यहाँ तो आप काट रहे हो, या तो उसको जला रहे हो.
करेक्ट.
हमारा सबसे बड़ा फियर क्या रहता है कैंसर में, कि जो बीमारी थी वो तो आपने काट ली या आपने जला दी, लेकिन ये कोई बॉडी के और कोई पार्ट में वापस आएगी तो व्हाट इफ दिस डिजीज मेटास्टेसाइजेस, विच मीन्स वो स्प्रेड हुआ तो. सिस्टमिक ट्रीटमेंट ये बीमारी को स्प्रेड होने से रोकती है. कीमोथेरेपी इज वन ऑफ दोज मेडिसिन्स विच इज सिस्टमिकली गिवन. या तो वो गोली हो सकती है, सो वी हैव ईदर ओरल कीमोथेरेपी ड्रग्स, या वो इंट्रावीनस होती है, जो आईवी लाइन हम एंटीबायोटिक्स जैसे कैसे लेते हैं वैसे आईवी लाइन लगा के हम दवाइयाँ चढ़ाते हैं, जो आपके पूरे सिस्टम में जाए और आपके सिस्टम में यदि ये बीमारी के सेल्स कहाँ छुपे हो उसको पकड़ के मारने की मदद करती है. वैसे ही टारगेटेड थेरेपीज रहती है, जो अगर आपकी बीमारी कोई स्पेसिफिक प्रोटीन एक्सप्रेस करती हो तो ये दवाइयाँ वही प्रोटीन को अटैच करके वो बीमारी वाले सेल्स को मारती है, जिससे कोलैटरल डैमेज यानी आपके बाकी के नॉर्मल सेल्स को नुकसान कम होता है.
ओके, गॉट इट. तो ये जो लास्ट में आपने जो बोला था, इसी को हम इम्यूनोथेरेपी बोलते हैं, और दैट इज समथिंग डिफरेंट.
सो इम्यूनोथेरेपी, एज कपिल भाई हैज रिसेंटली एक्सपीरियंस, इज अ गेम चेंजर इन ऑन्कोलॉजी.
ओके.
जिसमें जो बीमारी रहती है, आप एक चीज सोचो कि आपकी ही रोग प्रतिकारक शक्ति, योर इम्यूनिटी इज सो स्ट्रांग. द फैक्ट द 3 of us are alive today beating COVID when millions of people died was because our immune cells could identify and control those coronavirus in our body. So if your immunity is so strong that it can kill these viruses, these bacterias, you have millions of bacteria in this small room here as well. Why can't it identify and kill this stupid cancer cell in your body? The reason being, your body, your immune system is not programmed to kill your own part.
Correct.
उनको पता है कि शायद वो सेल्स नुकसान कर रहे हैं, लेकिन मुझे प्रोग्राम नहीं किया गया कि मैं मेरी ही बॉडी के सेल्स को मारूं.
करेक्ट.
आपकी जो कैंसर सेल्स हैं वो एक सिक्रीशन निकालते हैं जिसको PD1, PDL1 कहते हैं, विच गिव्स द बॉडीज इम्यूनिटी द मैसेज दैट आई एम योर ओन एंड हेंस डू नॉट हार्म मी. नाउ देयर आर ड्रग्स विच गो एंड इनहिबिट दिस PD1, PDL1.
Okay.
And hence expose your cancer cells to your body's immune system. And your immune system starts identifying and killing these cancer cells.
Got it.
And what was hence previously thought to be untreatable, incurable, it is not uncommon that people may dramatically benefit from it and people may survive for years. The newer iteration of these immune-mediated drugs is called as CAR T therapy, chimeric antigen receptor T cell therapy, where your cancer cells are taken in a lab, your immune cells are taken in a lab, and your immune cells are actually taught how to fight these cancer cells. And then these immune cells are repopulated in a large number and infused inside your body.
Got it.
मतलब आप दोनों को साइड में लेके जाते हो, आप बताते हो कि इसको कैसे मारना है, इसके फिर बहुत सारे जनरेशंस क्रिएट करके आपके बॉडी में डाल देते हो.
तो फिर ये सारे जो है कैंसर जो सेल्स है उसको जैसे लैब में मारा वैसे बॉडी में मारेगा.
एब्सोल्युटली.
ओके.
तो ये तो साईफाई हो गया. तो कल से हम सबको CAR-T कर देंगे और सारा कैंसर चला जाएगा. अनफॉर्चुनेटली ऐसा नहीं होता. CAR-T is something that we are still learning to understand. It does not work in all cancers. Currently, it is approved in blood cancers, which is leukemia, and some form of lymphoma and myeloma also.
Okay.
The data is very encouraging, where previously advanced cancers, जिसमें सारी treatment fail हो चुकी थी, a third of these patients are making it.
Got it.
Does that mean that every cancer can currently be treated with CAR-T? Not yet. But maybe in another 10, 15, 20 years, I believe we will reach those scientific advances where we will be able to ideally find out which treatment works best for that patient and cure what is curable and control what is uncurable for a very long period of time.
Okay. And जैसे rightfully said, see, oncology is a very advancing field, you know. तो जैसे आप बोलते हैं कि every 5-10 years there are new advances which are coming, and I think CAR-T is something which holds a lot of promise. Sir, एक इंसान है who's let's say diagnosed with cancer or has got a family member. What is the cost that he's looking at with आपने जितने भी एक्सप्लेन किया वो सब कितने महंगा रहेगा approximately?
So, number one, I think a very important statement in DTalks with Kapil that we should make is that everybody should be insured well.
Insurance, correct?
Yeah, not promoting any insurance company here, but we often take our health for granted. And it's important that we have a reasonably decent insurance to be able to take care of any medical exigencies and emergencies that come our way. So now, unfortunately, there is no one number or one figure, Kapil, which I can generalize, but every cancer has their own journey. For example, if you have a breast cancer, and if you are a very early stage hormone positive breast cancer, then you may undergo a small surgery, which may cost maybe $1 lakh or a couple of lakhs at best. You may undergo some radiation, which may again cost $1 lakh or a couple of lakhs. And you could actually be on an oral tablet, which costs 3 rupees.
3 rupees, wow. Okay.
While the same small tumor could be HER2 positive and hence may require about 1 year of targeted therapy plus chemotherapy, the cost of which may be around 10 to 15 lakh rupees eventually through the whole year, and the cost of surgery and radiation. So what makes cancer so dynamic and so different is that a same 1 centimeter looking tumor on a mammogram may end up making you spend 3 lakh rupees over a period of 6 months and you will be cured. Or the same 1 centimeter tumor on a mammogram make you spend 15 lakh rupees over a period of 2-3 years and you still may be cured, may not be cured. And hence, it's very difficult to generalize the cost of a treatment. But one thing to note, the costs are dramatically coming down. As newer and newer technologies come in, and generics, which India is the hub of, has made access to cancer drugs a real reality.
Okay. So, sir, जैसे आपने बोला कि every cancer, depending on कौन सा cancer है, 1 centimeter or whatever, the cost is going to be different. Where does MOC come in all of this? MOC मैं लोग को बता दूँ, it's Mumbai Onco Care Center, and obviously हम वशिष्ठ भाई के साथ बैठे. सर, आप अगर MOC के बारे में हमें कुछ बता सकते हो तो?
So, Kapil, MOC was born from the need of giving patients a place to take treatment, maintaining their financial, mental, frailties in this journey. Historically, before MOC was there, cancer was treated either in the large corporate hospitals where you would have access to very high cost therapy, or you would be relegated to smaller or larger government hospitals where you may have to wait for hours getting access to the treatment at the right time. And for everybody else, you would be walking into either a small, unorganized, dingy nursing home and taking therapy simply because you either did not have the financial bandwidth to walk into the Hindujas, Nanavatis and Maxes of the world.
Correct.
Or you did not have the patience to walk into a KEM or a Tata hospital and wait for hours for care and access. The other thing that then used to be also done is that you go once to these large hospitals, take a treatment protocol and come to your nearest hospital and be it your gynec, surgeon, orthoped, just take those chemo infusions in whatever way that they would give you. And hence, it was a very, very unorganized cancer experience that most patients were getting. We thought that can we actually regularize this entire experience and make it very, very homogenized as a process. So MOC has 3 large buckets that it focuses on. It focuses on a cancer patient's journey, where the ingress and egress out of a system is extremely succinct and very, very precise.
Correct.
It also focuses on a cancer caregiver's journey. So every patient has to go through, and the relatives have to go through an onco-psychological counseling. It undergoes an onco-nutritional counseling, onco-physiotherapy counseling, oncogenetic counseling as a part of the chemotherapy process. You don't have a choice. You have to go through it because it's important to believe that cancer is actually a disease and not a transactional treatment that we often write to the patients. And because chemotherapy is a very repetitive process, for example, you may undergo a surgery to remove a certain breast lump and you may require 14 to 16 cycles of chemotherapy. You stay in Mulund, Thane or Dombivli, would you want to walk into a large corporate hospital for a process which is so well defined? As Kapil Bhai mentioned that occasionally a 2-hour treatment process may end up taking 6-8 hours, not only of the patient, but also of the person who's accompanying the patient.
True.
So the livelihood of that patient and the relatives on the same day is gone for a toss. So we've created these micro centers of excellence. When I mention micro, they're about 5,000 to 8,000 square feet. We call ourselves community oncologists, where we are closer to you. We give you a community feel. They don't look, feel, smell like a hospital, but they have all the bells and whistles of a standard of care, homogenized cancer treatment. We are trying to create a very evidence-based cancer experience rather than an eminence-based cancer experience. So now we are about 54 oncophysicians working across 26 locations in about 5 states. And again, focusing on the cancer patient, also focusing on the oncologist. Previously, the oncologist would be running at 4 different hospitals, 3 different nursing homes. Now, I would have given a chemo treatment protocol in one hospital, then I rushed to the next hospital not knowing what is happening to this patient. So these are all sit-down oncologists. They would start their day at MOC and they would end their day at MOC. And having your physician in proximity to you when the treatment is going on gives you access to probably going in again and asking him questions that you have forgotten. Even at the end of the treatment, just walk in and say, bye, I'm going, I'm done. It creates a beautiful, as I mentioned, a community experience rather than a large corporate, dare I say, ivory towers of pain, discomfort, and processes, that one has to go through.
True.
So that was the real reason behind creating these large chain of community cancer clinics.
And it's been quite successful also, at that, because as aapne bola, community oncologist, that word in fact is very important because at the end of the day, from a patient's perspective who's undergoing so much of treatment, having someone accessible, someone available and someone in proximity is very important. So thank you so much for breaking, that entire cycle and being more accessible via the entire MOC experience is what I'll say.
Thank you.
Sir, बस आपको एक चीज़ पूछना था कि let's say for example one of my family members has been diagnosed with cancer. अभी diagnosis तो हमको पता चल गया, लेकिन as a relative मुझे और क्या-क्या पता चलना चाहिए?
Very, very important question, Kapil. What you should know once you know that you have a family member who has been diagnosed with cancer at the end of your first consultation with your physician.
Correct.
You should know the duration of treatment. You should know the frequency of treatment. You should know the bird's eye view of the cost of the treatment. At the same time, this will also help you organize, knowing how often you may not be available at work. So you and your family can start planning your routine basis this information. Also helping knowing the cost and at what time points these costs are going to be relevant.
Correct.
जैसे सर्जरी अगर 3 महीने के बाद हो तो अप्रॉक्सीमेट कॉस्ट कितना होना चाहिए, what may be the duration of hospitalization, will help everybody plan their finances better. Also having access to a very basic thing, as in if this patient is going to require 16 chemotherapies and if I'm working as a husband or as a son or as a brother, I may not be available for all 16 therapies. So how do I create my network of care where I invest in 2, 3 close family, close friends who will take turns to be available for those days to prevent what I again reiterate call as caregiver burnout. So
Correct.
knowing the cost of treatment, knowing the duration of treatment, also knowing the longevity of the cost at the right time points is very important. Also, you should have a very basic discussion on basic onco-nutrition even during this process till the time the treatment starts.
Correct.
Because from tomorrow you may stop wanting to eat something. And this onco-nutrition is also very, very specific. If you have a GI tract cancer, your diet could be very different from a lung cancer to a breast cancer.
ओके कपिल सर आपको पूछना था जैसे सर ने बोला कि रिलेटिव्स को टू कीप देम इन माइंड बिकॉज यू हैव टू प्लान अ लॉट ऑफ थिंग्स आपके केस में क्या आपको लगता है कि एवरी टाइम दिस इज राइट लाइक हाउ डिड यू मैनेज डिसमिनेटिंग दिस इंफॉर्मेशन टू योर रिलेटिव्स
So it takes time because सबके अपने अपने concepts हैं. Like my mom would become very emotional. Ragini's mom would become very emotional. So my dad's a doctor, so he may not. So basically it takes time. And I guess you have to create an environment, break the news, tell them what it is. Sometimes I guess get everyone involved with the oncologist 1 or 2 meetings so they can ask their own questions. क्योंकि everything वो मेरे से पूछेंगे मैं हमेशा बता नहीं पाऊंगा. So an all round approach 1 या 2 बार is also important कि सबको idea है कि क्या चल रहा है.
ओके
And then to create an environment which is positive all the time.
करेक्ट
So initial few days, definitely it's a negative vibe, upset, shock. But eventually, rather than going from why me, what can I do and how to face it and get better.
करेक्ट
That is the only thing which is important for you because that's the way you move forward. Because there's no point in always thinking why it happened to me.
करेक्ट
So you have to move forward. So I guess initial part is a little difficult, but eventually be honest with everyone, give them the clarity, maximum that you can give it to them, and I guess move forward.
I think honesty and clarity is very important because हम अक्सर देखते हैं कि a lot of cancer patients they change, their mentality changes. घर पे ही बैठना प्रेफर करते, बाहर नहीं जाते, छोटी छोटी चीज़ों में उनको असर हो जाता है. फिजिकली दे आर बिकमिंग थिन और समथिंग, क्लोथ्स डोंट फिट, यू नो दे आर ओवरसाइज्ड और समथिंग, दे लूज देयर हेयर. सो आई थिंक ये जो एक्सेप्टेंस की पार्ट आपने जो बोला है, ऑनेस्टी और क्लैरिटी से जैसे आप अप्रोच कर रहे हो, आई थिंक दैट विल गो अ लॉन्ग वे इन देम अंडरस्टैंडिंग देयर ओन डिजीज प्रोसेस.
जी. So patients go through a lot of physical deformity during therapy. And one of the commonest thing, like Vashisht would agree with me, कि लोग कीमोथेरेपी नहीं लेना चाहते क्योंकि बाल झड़ जाएंगे.
करेक्ट.
They will not look good. What will people say?
True.
तो मेरा कहना उन पेशेंट को है कि ये 6 महीने की बात है. इतने ऑप्शंस अवेलेबल है. एंड वंस द थेरेपी अकर्स, द कैंसर इज क्योर्ड, मोस्ट ऑफ देम स्टार्ट लुकिंग good again, and hair or something is a small byproduct to the longevity of life that they are going to enjoy.
True. Completely agree with you.
So a lot of cancer cosmesis is now becoming an integral part of decision making. We have scalp cooling devices by which you do not lose hair. We also now involve a dermatologist in various consultations if there are certain treatments which cause hypopigmentation or hyperpigmentation, to ensure that there is dignified quality of life when the cancer therapeutics are being given at the same time.
I think a cosmetic appearance is very important, and I think it's very good to hear that you all are integrating all of this पहले से ही जब एक diagnosis हो जाए.
Absolutely.
So sir, we've obviously had a lovely discussion on cancer, लेकिन you know there are some rapid fire cancer questions जो मैं आप दोनों के ऊपर one by one, you know, I'll just direct them and we just want an answer from you. ठीक है? So we'll start with you, Vashisht sir. One cancer myth you wish people would stop believing.
That cancer is incurable.
Okay. Sir, one symptom people should never ignore.
Weight loss.
Okay. So what do you think is the best time to get screened for cancer?
If you are a female, 40 years and above, and if you have a strong family history of cancer, 10 years earlier to when your family member was diagnosed with cancer.
Okay. So which is the most common cancer in India?
In males, the most common cancer is head and neck, which is usually tobacco related. In females, it is breast cancer.
Okay. Which is the biggest risk factor according to you for cancer today?
Is tobacco, smoking and smokeless tobacco, both.
Okay. Sir, one habit which you would change in every Indian household?
Like an addiction or
Addiction can be an addiction.
so tobacco?
Okay. Sir, a food that you would personally avoid to reduce cancer risk.
Processed food.
Processed food. Okay. Sir, is there something known as safe smoking as far as cancer is concerned?
No.
Okay. So whatever form of smoking
Smoking
is
is equally.
So the most underrated lifestyle change to prevent cancer.
Physical activity. It's the risk of cancer is smoking is actually second. Number one is sedentary lifestyle.
Sedentary lifestyle. You're talking to someone who's actually guilty of a sedentary lifestyle. अब मुझे डर लग गया ये
As
podcast के
charged.
बाद. Can someone fully recover from stage 3 or 4 cancer?
Stage 1, 2 and 3 cancers are curable unless proven otherwise. Stage 4 cancers are usually controllable, but a lot of stage 4 cancers are curable, like lymphomas,
Okay.
like germ cell tumors are curable.
Okay. Sir, can cannabis actually be used for managing cancer?
So the use can be to reduce the pain and discomfort towards the end as the disease progresses and the symptoms of pain and discomfort increase.
Okay. So can using your phone at night increase the cancer risk?
If you're too much on Instagram and defining your cancer treatment, yes.
Okay.
But otherwise, it lets you sleep poorly and hence may increase other illnesses.
So would it be safe to say that use Instagram only to see reels of detox with Dr. Kapil?
Especially the ones which has, Dr. Kapil and Dr. Vashisht for sure.
Correct. Is deodorant actually linked to breast cancer? This is a huge myth going on, so I would like to direct this to you.
So the honest answer is yes and no. Yes, because too much amount of chemical exposure for a very long period of time is carcinogenic in nature. But an occasional use of deodorant to control smell helps not only the person but also people around them.
People around, especially in Mumbai locals.
Yes.
Correct. So does the mindset of the patient impact the outcome?
Absolutely.
Okay.
The moment you are positive about it, the game changes.
Okay.
Completely agree.
Sir, is your gut health connected to cancer risk?
Gut is an organ. Let's all start accepting that fact. And gut health is a huge impact on your not only GI cancers but also other cancers in your body.
Okay. Why are so many fit people getting cancers?
So part of them could be germline because of a family history. The other is also dependent on what you eat. Again, exposure to too much amount of microplastics, processed food,
Okay.
barbecued meat, all increases the risk of GI cancers.
Okay. What are 3 gaps currently in oncology related healthcare which you still think India needs to address?
It's cure, control and palliate. So cure, you would want the patients to be diagnosed early. So screening people at the right time is a big gap. Control, once you're diagnosed with cancer, access to treatment and the right treatment is of paramount importance. There is a huge yawning gap in India where people still do not have access to routine treatment. And palliate, what cancers you cannot control, they deserve a dignified end-of-life experience. We have very few hospices, we have very few end-of-life palliative care experts to provide them that comfort care, not only to the patient, but also the caregiver in that eventual journey.
Okay. And quickly after rapid fire, it's a quick this or that segment. So sugar or fried food, which is worse?
Fried food,
Processed meat or alcohol, higher cancer risk?
processed meat,
Okay. Sir, mental stress or physical inactivity, which do you think is worse?
Physical inactivity.
Okay. What about smoking or pollution? Which is the bigger cancer trigger?
Both.
Okay. And last question to you, and I know you love this question, which is herbal remedies or allopathy for cancer?
So guilty as charged. I am trained oncophysician and hence I am addressed to answer and treat cancers to the best of my knowledge, which is based on modern medicine.
Correct.
So I believe that modern medicine has been a game changer in treating this fight against cancer in the last 6 decades.
Okay, perfect. So with that, we would like to come to an end of this podcast. Thank you so much, both of y'all, for removing time out of your busy schedules and for answering very basics about oncology, because this, I feel, is a topic which needs to be addressed. And thank you, both of y'all, for coming over here and, answering so many vital questions. Thank you so
Kapil,
much.
for having us over.
Thank you, Kapil.
Right.
Thank you. Well, what an episode we've got, एक तरीके से मुझे लगता है कि डॉक्टर कपिल सर का जो स्टोरी है विथ रिगार्ड्स टू हिज वाइफ, आई थिंक वी शुड लर्न सो मच फ्रॉम दिस. ये डेफिनेटली ये एक डिटर्मिनेशन, ये ग्रिट का एक स्टोरी है. समवन हु इज अनफॉर्चुनेटली सफरिंग फ्रॉम द बिग सी but wants to give so much back to society. I mean, really, hats off to the entire family. And we need so many more stories and examples. I'm not going to use the word warrior because जैसे हमें वशिष्ठ मनियार साहब ने बताया कि warrior जो शब्द है ये हम सिर्फ कैंसर को डेडिकेट करते हैं. Let's get away from this mentality. And at the same time, thank you so much to Dr. Vashisht Maniar साहब कि उन्होंने कैंसर जैसे बीमारी को इतनी simplistic format में explain किया हुआ है. It's only a master in his craft can actually do that. I hope you guys enjoyed this podcast dedicated to cancer. I want you guys to share, subscribe, spread love, like, obviously share all of this. Keep writing to me कि आप लोग को कौन सा टॉपिक के बारे में सुनना है, and believe me, I'll do my level best to get the best speakers to explain that topic in a really simplistic way. Till that time, please share, like, subscribe, Detox with Dr. Kapil.